So Caleb, tell me a little bit about your injury and when it happened and things like that.
All right, well, tomorrow is July 14th, which marks the 1 year. So, been a year out. I was, hit by a pickup truck, so I broke my L2 and then bled all the way up to T5, so it's crazy through there, so I'm up at a T5.
Okay, and when you originally came to H3O Aquatics, what were some of the benefits and things you were looking to get out of coming to use the therapy pools?
Well, of course, I was looking for, leg function, like everybody wants. But I was also looking for like a good workout, cardiovascular, and just, to get stronger.
And since you've been coming here, how have you seen the benefits of those objectives and goals reached?
It's been incredible. I've only been here maybe like a month or two, and I wasn't even expecting anything like this. Of course, I was hoping for it, but it's incredible how much, I've somehow got something working in my legs, and I can tell I've been getting stronger at every time.
Now, in the past 2 weeks, you've went over some big hurdles, and you've done some amazing things. Tell me a little bit about that.
Like I said, in the previous video, that was the first time I found a way to kick my legs, and from there I've just continued to get stronger. The video now, you can tell that, it almost looks normal. I've learned how to isolate muscles and not just kind of throw my whole body into it. I've learned how to control my muscles, for which I don't know how, but...
And so last week you were kicking a ball around, right? And you could target that ball at different angles and depths and different things like that.
It's pretty cool.
Now, how have you seen your upper body increase muscle-wise since you've been coming here?
Oh, dude, I'm fit, man. I got the guns.
All right. Thank you, Caleb.
Yeah.
So, Rodney, explain your relationship to Caleb for me.
Well, Caleb's my son. And that's our relationship.
Okay. When you were coming to H3O Aquatics, what were some of your goals and objectives that you wanted to get out of the therapy pool use?
Caleb's injury is lower motor, but what we're really looking for is a couple of things. We're looking for some way for Caleb to do cardiovascular, physically fit things that include his whole body experience. We've done a lot of research. Being in the water is good for his skin, good for his circulation. Being vertical, anytime you're vertical, it's good for your bone and your skeletal bone density things. And then on top of that, the mat or the treadmill, whatever you want to call it, kind of plays into the locomat training that we're seeing in therapy, but that's really upper motor. And Caleb's a lower motor, but we're like, we'll try anything to make Caleb better. And, H3O, Jim, and Mike, and the guys down here really are open to Caleb's injury. A lot of therapists will slot him as lower motor, and it really doesn't work. So this is a big positive for us. It's psychologically good for Caleb to see himself in that, a body image of seeing himself walk. He's more physically fit. He feels better about himself. He looks better. He's getting stronger. There's a lot of things with his injury. It's odd that he needs to be healthy, and being in the pool is healthy.
Explain to me some of Caleb's functional abilities to use his lower body extremities before starting his exercise program and now a month or so into the program.
Caleb had done very little therapy. He got hurt, and then we had the inpatient therapy, which included life skills in a wheelchair. This is really the only physical therapy type because of his injury. He has a better body awareness, and how he's walking underwater on the treadmill, he's doing a lot of compensating with other muscle groups in his upper body and leverage and things like that. However, there's no question in my mind of when you watch him on the treadmill or watch him in the pool that he is able to manipulate his body. And that manipulation at some point, somewhere, somehow, might be that thing that reconnects his brain to his lower body.
We have Jim Dalbo with us, one of our trainers who specializes in training with spinal cord injuries at H3O Aquatics.
I had a great opportunity to work at MTSU and participate in their underwater treadmill lab. Through the research there, we found that individuals with spinal cord injury can make incredible improvements when involved in exercise and therapy in an aquatic environment. And after finding all the improvements that we're still finding improvements in there, but after finding the improvements that I guess could happen, could be achieved, I brought what I know here to H3O, and we're finding the exact same things when working with individuals with spinal cord injury.
As Caleb's trainer, briefly explain the improvements in his physical capabilities that you have observed after working with him for the past 6 weeks.
All right. Well, Caleb first came here with a T-level complete injury, which means he doesn't have any, or he did not have any sensory or motor capability below or within his thoracic spine, throughout thoracic spine down to the rest of his body. So when he came here, he could not move, he could not feel below that level. Through the great facilities we have here with the underwater treadmill and especially aiding, or I guess putting the person in an aqueous environment and eliminating or partially eliminating gravity, we've been able to, at first I was able to work with him on the treadmill and move his limbs for him, and then over time, over the next few sessions, I could feel force coming from those limbs as he really thought about them, and then more force became more control, and more control became initiation of movement through those limbs without me aiding in any way. And these are very intense sessions, and now over the course of maybe a month and a half, he has now gained the ability to walk on his own without my aid at all, initiate all footsteps, all past the center of mass, and walking up to and well past a mile every session in the water. And today we tried the bike, and we saw partial initiation, well, full initiation and partial cycle ability on that bike as well. And he continues to make great improvements and push me as a trainer.
What are some of the things that you think have contributed to the improvements that Caleb has had since coming to H3O Aquatics?
I'd say the biggest, by far, is the partial elimination of gravity. From what I've read and through my previous research, I've found that a lot of spinal cord injury rehab in the past has overlooked the fact that, and it's taken for granted, gravity. And there have been a lot of body weight assisted techniques and therapeutic techniques and rehab techniques and things like that, using either robots or harnesses and things like that that can be both uncomfortable but also don't really help the individual with initiation of their own footstep. It really does it for them. And so here we're able to partially eliminate that gravity, but also work with him to get him to be able to initiate that movement, which really brings the brain into it, which is what starts the movement of the muscle anyway. And so working both in warm water, which helps the muscles, and several flotation devices around him to keep him safe. We've got a great chair lift over there that helps him in and out of the pool in a very safe way. That treadmill really helps us get a gait pattern in, first passively, and then starting to work in some initiation on his part. And so all of that equipment put together, from what I've seen, has done an incredible job in helping gain his gait capabilities.
So Jim, what are some other conditions that you think would benefit from exercising in an aquatic environment?
Well, really anybody that has inflammation, say fibromyalgia, arthritis, things like that, they would definitely be able to benefit from the warm aquatic environment, also the lower impact of the partial elimination of gravity in the water. But also what we're finding is that people with neuromuscular impairment can also or neuromuscular disability or things like that can also improve their gait or work out with lower impact and safely in an aquatic environment like this. Thank you.